Our next session is Sir Liam Donaldson here. Oh, he is, yeah. And Dr. Agis Tsourous. Thank you. Well, good afternoon, and thanks for making the time and being here. And you probably got the gist of this. This is about the health and well-being afternoon. We're looking for ideas. We're looking for anything that will help London tackle the health inequalities and any interventions and sets of policies. And you're both expert in this field, so please tell us what the Commission could do.
Well, thank you very much. Good afternoon, everybody. There are a number of things, I think, when you look at the health of populations, particularly in a big international city like this, that you need to do and think about. The very first thing that I think public health needs is a strong voice, and what Jim Collins called BHAG, big, hairy, audacious goals. So public health people like to be able to champion, and they like to be able to pursue goals like the smoke-free public places, the minimum price for alcohol, some of the initiatives on restricting access to junk foods around schools and so on. That doesn't mean a lot of targets, but it just means something that people can coalesce around and campaign, and that has a knock-on effect to other areas of public health. After people have succeeded on one of those initiatives, then they're more likely to pursue others, and it keeps the general flow of public understanding and public perceptions and moves it towards social norms which are more health orientated. I heard the tail end of the last bit of evidence and the point that Yvonne Doyle made. There isn't any point in having a one-off campaign for walking and then letting it disappear under the surface. It's very, very important to keep that in the public eye. As far as the goals are concerned, you could say, for example, why wouldn't London have the lowest prevalence of smoking in the world? It doesn't at the moment, nowhere near. Indeed, other parts of England are probably faring better. So that would be an example of something, I think, which could really galvanise both public support and civic pride to try and achieve that. So a clear public health voice, ideally a person that the public can recognise as the main voice of public health, but lots and lots of debate in the public arena on a constant basis. The second thing that I think needs to be sorted out is a clear sector-by-sector plan for health. What will transport do? What will education do? All of those services and areas of and different sectors should be able to make some contribution to improving health and reducing inequalities. So that would be the second area, that those plans should be audited, reviewed, made public, and challenged by the public health authorities. Thirdly, London performs relatively poorly nationally on preventive services. It has the lower levels of immunisation than other parts of England. It has lower levels of breast and cervical cancer screening, and that's been the case now for about 20 years. What is London going to do about that? Is it going to be satisfied with sitting on that poor performance, or is it again going to move up? So that's to do much more with the organisation and delivery of predominantly primary care services as well as public services. And then let's not forget about health protection, ensuring that there are strong emergency plans in place for a new and emerging infection, whether it would be pandemic flu or something very novel. Is London prepared for that? Is it prepared for a bioterrorist attack? Those aspects of health protection are important. And then there's the bread and butter of health protection. London has the highest level of tuberculosis in the country. What's it doing about that? Why has it got the highest? Why hasn't it got the lowest level of tuberculosis in the country? Because it takes pride in having the best public health services. So there are performance points there as well on that side. Then and I'm not going to talk at great length, don't worry. And then there's the whole question of what to do at the neighbourhood level. The previous government flirted with different ways of taking area-based initiatives. It started with health action zones, abandoned those very quickly, and then moved on to others. There is a lot of experience internationally about how to galvanise communities, ask them to take ownership and be in the driving seat on improving their own health. Those lessons have not been particularly adopted, certainly in a widespread way across England. So sorting out the approach to neighbourhoods and smaller communities and what they can do about their health. And then I think probably London would benefit from having some sort of pan-London Institute for Public Health, whether that's for research, training, and so on, but something that looks at the natural geography of London and creates a true centre of excellence, which would be rival some of the best schools of public health in the world. We don't have that at the moment. We have a very fragmented system. And then finally, I think without you cannot ignore in a big city like this the problem of drug addiction. I think it has ramifications across a very wide area of social policy and the economy. And so it's been an area of public health which traditionally has not been as much in the mainstream of public health as some other areas and some other problems. And I think particularly in this city, trying to make a really big impact on that would make a big difference.
Thank you for that. There's a huge amounts in there, and thank you for that, Liam. Dr. Agis, what would you have to add to that?
Well, first of all, thank you very much for the invitation. I come from the European Office of the World Health Organization. It covers, it's a huge region and diverse region. And it is a region that very early, many years ago, recognized the importance of the local level for action for public health and also working directly with local governments. I have also been listening to some of the presentations and also to what Liam just said. I would like to perhaps to come from another perspective and say that today there is no excuse not to think seriously about dealing with health in a different way, because there is overwhelming evidence. 30 years ago, or whenever it was when the first inequalities report was launched in this country, the evidence was still weak or scant. 30 years on, I mean, you have had your own Marmot review in London. There is no end now to the bulks of compelling evidence to do something about inequalities. Yeah. But it is also a great shame to think about inequalities today with the evidence we have only in terms of focusing on some vulnerable groups, some groups that are particularly disadvantaged, and not think of the whole spectrum of the social determinants of health. I think no city today should be seriously saying that they are doing something about equity without investing in a healthy start in life, for example. I mean, that's the future of any society. There is no, we cannot say that we are taking seriously all this evidence unless, as Liam was saying before, we think about communities, neighborhoods, people. I mean, the frontiers of new public health, what they are today. Respect for human rights. Are human rights today in Europe being challenged? Absolutely yes. Why? Because there is a serious change in the social and demographic landscape of Europe. So people getting older, migrations, the migrants, all these issues constantly challenge our understanding of human rights, universal coverage, the dignified life of older people, and so on. What is another one? Issues that relate to the participation of people in decisions that influence their health. It has to do with empowerment. Empowerment is not a sweet word. There is lots of evidence to suggest today that resilient communities that can adopt, react, withstand all these changes that are happening today are actually an asset to our societies. What do we do to create resilient communities? What do we do to promote health literacy? I believe health literacy is today one of the most promising areas of modern public health. It's not only about telling people what is good or bad for them, it's about health literate institutions, health literate communities, and so on. We keep on talking about the epidemic of non-communicable diseases and obesity, and yet we keep thinking continuously about smart messages, short campaigns, and so on, and we don't think in a comprehensive way. I think the big weakness of modern health systems is lack of investment in prevention and health promotion. And if we don't do this through robust public health today, we're going to find it in front of us, because health systems will not be able to cope with the multiple morbidities of an aging population tomorrow. The life course approach that we advocate in public health is nothing else but thinking 30 years before what you're going to be like when you are older. So I think in London, I mean, I studied here, I worked at local level in an authority in the center of London. I mean, I always thought this is the mecca of public health. You have more public health brains and capacities per square, whatever, meter, kilometer, or mile, than anybody anywhere else in the world, I would think. I mean, if you don't crack this, but not in a way which is, what is a new good initiative? Bloomberg has done very well thinking about smoking in New York, or other initiatives he has taken, a mayor who took public health at heart. But to me, it's not just about that. It is about having a systematic plan. It's about whole of government and whole of society approach to health. Can London have a true intersectoral plan? Not just thinking, who are the other sectors that can help me solve this and that and the other problem? But Leah said before, what is the contribution that other sectors? Can you make health a performance indicator of this great city? Not just in terms of its economic development. Can you link health and development? Not just think about health. I mean, can we talk not health care, but the health of this great city? So I think it's a kind of change of mindset in this respect to think of health. There are many good examples I can give you, and why some cities. Earlier the transport. Speaker spoke about cycling, for example, but again, it's not cycling from A to B and then you don't know. You start from nowhere and you finish nowhere. But it is thinking. I live in Copenhagen. I know people think that Copenhagen was created with cycling lanes by God on the seventh day, which is not true. It took a lot of political fights for that city to achieve today that 39% of the workforce in Copenhagen go to work by bicycle winter and summer. And that has to do, it's a benefit for the energy sector, for the air pollution, for the environment, for the traffic sector, for obesity, for physical activity, for anything. So I suppose my advice would be think big. Have a vision of health for this city, which is linked to its future, with development, You need to embark on a major effort to get the right stakeholders engaged in this. And I think this city could be a real dazzling example in the world.
Thank you. There's a lot of passion there. Thank you very much for that. Thank you. Thank you. Thank you. Right.
I'd just like to say something to this gentleman. You know, it's European, I mean, I came just from a world-class city in Europe. He was asking why the inequalities. It's because in London, the inequalities are ingrained and widely spread among the social classes. There's too much social classes. They don't want to lose the power. You know, I mean, look at the panel. Different Darzi, which is from different. You know,
I'm Spanish. Yeah.
Pardon?
I'm not. Yeah, I'm not from here. Yeah. Well, she's from Ireland.
The inequalities is
Presume I'm from the middle class.
There you are. Yeah. Could we just concentrate? Thank you for the comments. Could we just concentrate on some questions, because these two experts have a fairly short time to.
Thank you very much. And thank you, Salim, and thank you, Agis. So what I want to ask your advice about is the relative role of the mayor and the local, because you've both described the importance of getting communities, you know, to get engaged. And I think there's a lot of activity in London, but I'm not sure, as we've said, it amounts to the greatest city in the world or the best health in this country. So we now have this opportunity with local government where we have levers. But what, at the edge of our seat, should we be asking local government? And where does that intersect with the role of the mayor and the city? Because where we don't want to be is people standing off on this. It has to work as a system, and it has to make sense to local people as well.
Well, I think that the first thing to say is that at the moment you have a very strong national element to the way that public health is delivered. And one of my distinguished predecessors, Donaldson, who did the inequalities report in '98, just after Labour came to power, did an excellent report, produced 39 recommendations, almost all of which were about national action, not about local action. So I don't know that, although responsibility for delivery of public health has been devolved to local authorities, there's still a very strong top-down approach to determining priorities and setting a framework and saying what you should do and what you shouldn't do. And I think the big breakthrough would be, in my view, would be if the responsibility for public health were devolved in its entirety to the mayor. And then the relationship with local authorities is already established in other parts of the mayor's activities. And surely it would be much easier to do that than the current matrix arrangement we've got, which is from the Department of Health through its agency, Public Health England, into local authorities. And then the lack of any coordinating mechanism for local authorities or any performance management mechanism on the local authority side. So it's actually a very complex both priority setting system and implementation system.
The mayor does have powers, though, but not resources. Am I correct?
The mayor does have powers and a statutory mandate on inequalities, but
no resource.
No resource, and also no requirement to take the mandate forward, but to have account for it.
But that's like having another slightly bigger local authority with only some of the local authority's responsibilities. It's not a kind of autonomous direction-setting role for the whole of public health in its entirety, including those elements in primary care.
So, Liam, can I just press this? We went to New York, some of us, in November, and we're very interested in what not just Mayor Bloomberg, but his health commissioner had achieved. And it was about a big vision for the city. And we've come back with that idea. But of course, what they also did was they didn't engage locally. In fact, they didn't know much about what went on locally at all. They did legislate a lot, and they used programmes and the law that they had inherited to get change. And it appears as if that change has been sustained. For instance, they do have a very low tobacco prevalence. But culturally, London wouldn't go with this. There are elements that we can learn but we can't use the law in London. So we have got this system we've inherited.
Yeah, but you would have, as I said, you'd have, if you had a health commissioner or words to that effect in the mayor's office, the relationship, and I agree with you in New York, the boroughs sort of handle their own affairs, but they have a very different tradition in public health anyway. But as I say, the relationship between the mayor currently and local authorities on other areas of other sectors, I think, would allow the door to be fairly wide open to doing public health.
Thank you.
Yeah. I think that the mayor, irrespective of whether he has a remit, a direct remit for public health, he is responsible for health in the context of our understanding of the determinants of health. I know that we think, and I think it would be great if there was a public health commission that was under the authority of the mayor, but in a way the mayor is also a powerful convener in the city, and he is in a position to bring together, to first of all, he's in a position to put health as a core value of the city, which is very different to say, oh, we also managed to have a public health office here. That's not what I'm talking about. It's saying London recognizes that health is a core value for its development. And we recognize that the majority of the sectors that are within our influence are actually our major contributors, or if not careful, they could be detrimental to health with their activities, which refers also to systematic health impact assessment and so on. And somehow you make health your priority. And then if eventually there is the possibility to create also a structure that will bring more cohesion and coherence in the city for health and public health, that would be even better.
Thank you. Anyone? Yes?
Can I just ask just one question of you? And that was, I'm really impressed by the vision that you've got and the various sectors working together. But if I could ask you just one thing that you mentioned, which was about giving a healthy start in life to those in London, what would you do? What would it be? What would that vision be for the healthy start in practice?
In practice, it means that every mother who is pregnant, every family expecting a child to come in life, and the early years of that life will have around them all those essential resources, which is not only about the access to the essential health services, but it includes social support, it includes the physical environment within they live, education, key sector for a healthy start in life. Especially preschool can tell you today is one of the best predictors of what is happening in terms of performance of the child in later life, which directly is then linked to health. So here you have a range of 4 or 5 key sectors who, if they focus their minds and say, let's give and irrespective of the economic situation of the family, let's make sure that this child will have the best support at that stage, and its family, that's an investment. So it is not about healthcare, it's about all those services in an integrated, coordinated way.
Can I add something briefly on that? I mean, basically, I agree with what Agis has said, but the broad answer to that is by applying the evidence of the things that are proven to work. There is no mystery associated with it. But I'd go back to my point about the need for strong leadership and imagination, that you also need to add on top of that, to keep engaging the public's interest in the subject, whether it's the health of children or early start or whatever, and coming up with imaginative ideas. If you look at the Scottish Government, and I'll just mention one thing they did in addition to all the things that are well established and evidence-based. They set a goal that every child in Scotland should have a bedtime story every night, and it came out of their very scientifically based work looking at cortisol levels and stress amongst children in deprived communities. So that sort of imaginative, holistic goal really sets people's blood racing, and that's what you need in public health. Without passion, there will be no improvement in health.
Thank you.
Good point.
I heard you say empowerment gives resilience. Where in the world is doing that better than we are at the moment, and how are they managing to do that so that individuals' participation in their own healthcare?
Well, this is a complex issue, but it's also, I think, one of the most fascinating issues. There are societies that, by their nature, they are a more closely knit family and sort of relations kind of systems, which create social capital and the ability to cope, withstand, adapt and respond to circumstances. But investing in other societies proactively in mechanisms of consultation, involvement, engagement of individuals and communities. And you can see that at different levels. And I'm not talking about lip service to that. Because some people say you go to countries and you talk about community consultation and say, oh, well, we produce this document by a group of experts, and then we sort of upload it on our website, and community and NGOs had 3 weeks to respond. That's not community participation. Community participation at a neighborhood level, at a level that you in your desire to create ownership, a common vision in your city, you will find ways to engage different interests. And that in itself creates trust. And it creates a dynamic that will say, yes, we can influence what makes us healthy in our city. I mentioned health literacy before. It is a great area to look into carefully because it's an area that it is not only about the individual. Are the institutions in your city health literate? How am I as an individual able to navigate all this information and knowledge kind of systems around me in the best interest of my health and the health of my family? So that's literacy. It's not that I know that saturated fat is bad for me. It's much, much more than that. But there is evidence that shows that empowerment pays dividend in terms of health outcomes. That's what I mean. It's not a philanthropic idea. It's an idea that makes a difference.
Thank you. Kaz?
Thank you. I just wondered where you felt health and wellbeing boards might fit into this, and secondly, if at all, and secondly, how you felt we might manage the difficulties with the churn in London's population. So there are the Londoners that live and for a lifetime here, and then obviously we've got a large churn of people who either come into the city for short periods of time or to work here, and how you meet the varying needs of those populations.
You start if you want to.
Go ahead.
I'll be very brief. I think health and well-being boards, I don't know whether there's been a proper evaluation of their effectiveness. I think there probably should be. We should learn from the ones that are most effective. I don't have a particularly strong view about whether they should be part of the design of any future system, but I think we need to know what people think about their effectiveness. You want to do the second one?
With regard to this mix of population, Europe has changed has changed in terms of its social landscape dramatically. And there are countries that were not used to deal with migrants and with different communities coming from different cultural backgrounds. And they are struggling. They're struggling because, of course, when we talk about patient-centered care, and you have, like in Copenhagen or in neighboring Sweden, 150 languages spoken in the city, then you begin to understand that that's a different scene compared to the homogeneous kind of practice that a GP would have had. But you know, because 30 years ago I was working and studying in this country, I was always impressed that in this country you have a legacy of experience working with different societal, ethnic minorities, whatever they are called. I mean, there is something here, and of course in this city, which is, I believe, an understanding of what it means to deal and care for different people that many other cities in Europe would be very jealous and very envious to have that starting point. Of course, things are getting more complicated today. And if you put on top of that the financial downturn and many other things, this new poverty and so on, this is even more challenging. But somehow I would have thought that you have that critical mass of knowledge and experience to build on that very few cities, I believe, in Europe have.
Thank you. Thank you. Thank you for that. I mean, what I got out of this is I think it's worthwhile to look at the structure. Although I never believed in structural change, I think what you were suggesting, just go and build a community and start from bottom up and capture the hearts and minds of Londoners. But I think there is a structural issue if the mayor is to be involved. So it would be great to get a little bit more from you in due course if you allow us to engage you further. We're happy. Where are you based now?
Copenhagen.
It's not far away from us.
Not far away.
And
we
we'll
would
come
be
cycling.
Delighted to work with you.
Thank you.
And I'm in Paddington.
And you're in Paddington. So I'm really very, very grateful. And thank you for being so generous and open and in your advice. And this is an area that I see as being the pinnacle of this Commission's work, is the health and well-being and public health. So thank you. And you've also been very generous about London, which is very nice to hear. Thank you. Thanks very much. Thank you.